Hi, good evening. Austin Mayor Steve Adler. You got a minute? We're going to go over some of the virus numbers, the COVID-19 numbers. You can see what is yet another day of encouraging news. We'll talk about that. We'll talk about vaccines. We'll touch on homelessness. Not too much tonight because tomorrow night is when we get Dr. Escott's slides. So we'll have a lot of slides then. But let's go ahead and begin. Let's take a look at the dashboard that we always start with. This is the key indicators and the staging document. Here is the chart. You look in the bottom left-hand corner, and you can see that new admissions are down to 68. That takes our 7-day moving average down to 81. You can see 81 on the chart. We had reached a high on January 9th where we were up to 94 for a 7-day moving average. And then since then, it's been coming down. We're down to 81. Number of new cases today, 544 new cases. The 7-day moving average, 577. So we've managed to beat our 7-day moving average. We have the overall positivity number. It's been almost 13%. We'll get a new number tomorrow from Dr. Escott. This number is updated once a week. Let's talk about hospitalizations, ICUs, and ventilators. The numbers down at the bottom of the page are the 7-day moving averages, but let's go ahead and see what the actual numbers are. So let's get in here. Let's get to the Chrome tab. Let's share this chart. Alrighty then. You can see we've reached 65,507 cases. That means we've gone over the 65,000 mark right now. The number of people that have are hospitalized right now, 577. The 7-day moving average is 586. So we're below the 7-day moving average. Of that 577, 28 of them are in the alternate care site. I think about 15 people have gone into the alternate care site and been released over the last week or so that it's been open. The capacity of the alternate care site right now is about 50. We're going to continue to increase that capacity so we can take more and more people out of our hospitals that are not high acuity folks to free up rooms in our hospitals for the more serious folks. ICU, number of people in ICUs tonight, 157. The 7-day moving average, 170. So we're below the 7-day moving average there. Ventilators, 90. 7-day moving average, 101. So again, we're lower than the 7-day moving average, which is a good thing to see. You know, here on this page is the epidemiology chart. That you can click on and see. When you click on that chart, the white dots show you when we had policy changes, and you can see what happened as a result of those policy changes. Usually look about 10 days after the policy change to see whether it had an impact. The white dots show you this is when, for example, here on April 2nd, the daily count, this is when the state of Texas entered its social distancing order so that you only had essential activities only that people could do. You can see the numbers stayed low. But if you look at that epidemiology chart, you can see when Texas opened to phase 1. You can see when it opened to phase 2. You can see when after it opened to phase 2, I remember we opened a little too fast without measuring stuff, and then our numbers started going up. This was phase 3, and then the numbers really started rising. This is where Austin issued its revised orders with some additional restrictions with respect to masking, and you can see the numbers started going down. This is where the governor paused his work. This is where the governor issued his face masking mandate. Remember, we already had it in our city. That's when the governor kind of endorsed it as well. This is where Austin Public Health entered its emergency rules. And you can see then numbers started going back down. So you can see how what we're seeing, this is where we extended our orders back on August 14th. Numbers stayed low. And then as we got past Thanksgiving, the numbers started going up. That's when we got that bump. Our numbers continued to go up. And it was about in this period of time here that the county judge and I issued our curfew in the evening to keep people from going out on New Year's Eve weekend. Worked for the first night. The governor ultimately got that reversed in the Supreme Court. It's still pending in the court now because the Supreme Court sent it back down without deciding it. But 10 days after we did that, numbers started going back down again. You know, not only did we not see a bump on New Year's Eve of people gathering together, we actually saw a behavior change that probably began about New Year's Eve that started driving our numbers down. Now, it's a trailing indicator, so it's not till 10 days after that period of time that you would expect to see the kind of changes occur. But here we are. This is January 8th. The count was 151. This is about the time that we saw the numbers start going down in our city. So we're beginning to see some encouraging numbers, and we can't let up. We have to continue masking whenever you're around anybody not in your family, continue the social distancing. If we are in fact dropping the numbers now, and it looks like we may be, that's our best chance to get more and more kids back in school. It's our best chance to go back to the occupancy levels that we had in restaurants before, open up more businesses. Let's stay disciplined, even though we're tired, even though the vaccine started to come out. Let's maintain that as best we can. Let's take a look at the University of Texas modeling so we can see what that shows, because it also reflects the better numbers that we're seeing right now. Here's the University of Texas page. This is the Austin dashboard. It's gone down, the R value down to 0.86. Remember, we were up to a number that was 1.3 something. Last week it was 0.96, I think. Last time we checked, and we were on this got a minute, it's now down to 0.86. I mean, there's only an 8% chance the epidemic is growing. 14-day change, 20% fewer in infections, so we're on the way down. And you can see here's hospitalizations. The aqua line is one that's heading down. Hospitalizations, the dots are the actual numbers. The gray lines are the possible numbers. The aqua line is the most likely scenario. ICU patients, you can see how the numbers going down, which is what we're seeing right now in our city. This is carrying it through to March. But here's what I want you to see. Remember, our goal was to stay under 200 ICUs, and we set up triggers. And what we said was, if we pay attention to the triggers and change our behaviors when the triggers tell us, we will be able to have that trigger go off early enough that we ought to be able to stop ourselves before we get to the place we don't want to get to. 200 was the number we were trying to avoid. I want you to take a look at this chart and see just where we are. This is the 200 line right here, cutting across. And you can see what happened here on January 12th. We were up to 190, but we've managed to stay under 200 as a community. That's because, one, we had really good modelers in the University of Texas, really good public health people, and Dr. Escott and Director Hayden, cooperation with our hospitals and all our partners, everybody messaging to the community as we were beginning to hit the triggers. And you can see that we were able to stay below the 200 number. That was our goal, trying to avoid. not often does the planning hit the reality the way that we see there, but it's something that is that's encouraging for us to be able to see. We can't rest on our laurels. We can't say mission accomplished. We still have a ways to go here. More and more people need to get the vaccine, but for several months, please. We've shown some diligence the last couple of weeks here with masking and social distancing. We need to keep it up. With respect to the vaccines, Saturday, Austin Public Health completed the final doses of their second allotment from the state of 12,000 vaccine allocation. It is anticipated that Austin Public Health is going to get 12,000 more early this week. Might have come in late today, not sure, hopefully tomorrow. As soon as APH, Austin Public Health, receive those second doses, they're going to start providing them to folks in the city. Everybody who received a first dose from Austin Public Health will be notified that their second doses are here when it's time for them to take them. And then we're going to, if you got your dose, APH will be reaching out to you to schedule your second dose. That would be the people initially that got their second dose of that first closed clinic during the last week of December. Everybody, please be patient as these doses are coming in. Travis County is home to about 550,000 people that are in Group 1A or Group 1B. 550,000 people. We've only received in the county about 126,000 doses so far. So you can see how many hundreds of thousands of people we have in 1A and 1B who have not had a chance to get a vaccine yet. I understand the frustration. Please be patient. I was on a call last week with Dr. Fauci on like 2 or 3 different occasions. Some of the officials in the White House that are promising they're doing everything they can to speed production so as to speed the supply. Please know that every vaccine we're getting here in Travis County, we're getting in people's arms right away. I do urge everybody, go to the Austin Public Health vaccination registration. Please sign up. You can sign up whether you have insurance or not. You sign up whether you have documentation or not. Sign up whether you're over 65 or not. Just sign up. Get you signed up. It doesn't mean when you register that you're going to automatically get a vaccine appointment. In fact, we know that not to be true given the numbers of people that are involved. But please go ahead and register in the system, and then Austin Public Health will contact you. When you're eligible to schedule an appointment to receive the vaccine, you don't need to check the system unless you receive a notification to sign up for an appointment. If you don't have internet or computer or email access, call the Austin Public Health's nurse line. Nurse line, that number is 512-972-5560. That's 512-972-5560. And the nurse line will help you register. If you can't remember that, call 311 and they'll connect you and get you to the nurse's line. But that's where you want to go. Go to austintexas.gov /COVID-19-vaccines, and that's where you can register. Again, Austin Public Health will be reaching out directly to individuals that got their first doses with Austin Public Health to schedule the second shot. You're going to be able to schedule your second dose in a separate process from the people that are receiving their first dose. 2 different processes. So if you've already gotten your first dose, don't go back and register again for another first dose. We'll get you that second dose in a separate system. Hey, if you got your first dose from an organization other than Austin Public Health, you should contact your provider about receiving your second dose. The state is saying that every provider that gave out first doses will be receiving second doses based on who it was and the number of people that they gave their first doses to. So you should be able to get your second dose from the same people that gave you your first dose. But overall, be patient. Lots of people over 65 are not able to get a vaccine right now. It's because we just don't have the vaccines to give out. Hopefully, if the president is accurate about getting 100 million doses out in the next 100 days, then there should be more supply coming to us. We'll be able to get it to more people. Conclude just real quickly on homelessness. The City Council had its first work session today. We discussed and had our first briefing on the homeless this challenge from our new homeless strategy officer, Diana Gray. She was great. This is somebody that's been real familiar with what's happening in our city as a consultant for quite a while, been in this area, in this field for quite a while, helped a lot of other cities, knows the players in our city, knows where we are. So she is hitting the ground here running in pretty incredible ways. You know, when we passed the ordinance we passed back in the summer of 19, we saved a lot of people. We got people to a safer, better place than in the woods and in the streams where they were. We had a lot of people that were able to get support services and health care that were not getting it before. And everybody should feel really good about what we were able to do for a lot of people. But I will also say that I see and I hear the concerns that are playing out now among a lot of people in our community. I walk by and drive by and see the tents that everybody's seeing right now. None of us want any of our neighbors living in tents under freeways. We want them in homes. But we know that hiding people is never going to end homelessness. Only housing people can do that. The worst thing we could do would be to go back to where we were before, where we have an absolute camping ban and people are sent back out to the woods and the streams, to those lonely places. Again, doesn't help anything. The challenge grows exponentially until it's so big again that the scale is such that we can't do anything about it. We still can. But there's got to be a choice other than going back to where we were and doing what we're doing now exactly the way we're doing it, because we have to do better. The city progress was certainly slowed with COVID-19. We got 5 additional motels, but they've had to been put to the use of isolation facilities and protective lodges. As the numbers start going down in the virus, one of the benefits of that is we're going to get some of those facilities back again and able to use for permanent supportive housing. We're going to buy some others. You know, the City Council this week has on its agenda buying 2 more motels with just about 150 units of permanent supportive housing. But we also know that we can't spend all our attention on the long-term solution. We have to do something about the short-term challenges that we have. So the difference between what we've been doing and what we need to do is we need to spend even more attention on emergency and rapid rehousing so that we can do a better job of managing the spaces in the city that should be shared spaces in our city. And that's where we need to get to. Those are where the conversations are right now with partners all over the city and the county joining together. There's going to be a lot of work on that that's being done here in February. There's going to be a resolution coming to council that starts looking at particular locations so that we can start building encampment strategies to deal with the challenges that we see and work to get people out of those places and into better places. That's all I have for tonight. Let's gather again here tomorrow. We'll have Dr. Escott's charts and numbers. We'll have a more rigorous go through. But for the rest of the evening, y'all, good night, take care, and be safe.